It is no secret that many men experience difficulties with their sexual health as they age. While various treatments are available, one of the most well-known is Viagra. This little blue pill has been around for over 20 years and has helped countless men worldwide. However, despite its popularity, many people still wonder if Viagra is safe for them. In this video, we'll explore the science behind Viagra, how it works, and the potential risks and benefits of this medication. First of all, let's dive into the basics of Viagra. Viagra, also known by its generic name Sildenafil, is a medication used to treat erectile dysfunction. It was first approved by the FDA in 1998 and has since become one of the most commonly prescribed medications in the world. Viagra works by increasing blood flow to the penis, which helps to produce and maintain an erection. This is achieved by inhibiting an enzyme called PHOSPHODIESTERASE type 5, or PDE5, which breaks down a chemical called cyclic guanosine monophosphate, or CGMP. By inhibiting PDE5, Viagra allows CGMP to build up, which causes blood vessels in the penis to dilate and increase blood flow. While Viagra has proven to be an effective solution for most men experiencing erectile dysfunction, it's essential to acknowledge that it may not be effective for everyone. Research indicates that roughly 30% of men with erectile dysfunction do not respond to Viagra. It's important to note that while Viagra facilitates the physical process of achieving an erection, it is not a cure for erectile dysfunction nor enhances libido or sexual desire. Its mechanism of action lies in increasing blood flow to the penis, which results in an erection only when sexual stimulation is present. Therefore, it's essential to discuss the potential outcomes and limitations of Viagra with a healthcare provider before commencing treatment. When it comes to determining the safety of Viagra, it's essential to consider the potential risks and benefits associated with its use. As with any medication, there are several factors to consider. Let us begin by examining the possible benefits of taking Viagra. As previously mentioned, Viagra is highly effective for most men experiencing erectile dysfunction. Studies indicate that it can improve erectile function in up to 80% of men with ED. Furthermore, Viagra is generally well tolerated and adverse side effects are infrequent. However, it's important to note that while serious side effects are rare, the possibility of developing adverse reactions cannot be entirely ruled out. Therefore, before taking Viagra, discussing the potential benefits and risks with a healthcare provider is crucial to determine if it's the right treatment option for you. It's important to note that while Viagra can be highly effective for treating erectile dysfunction, there are potential risks associated with its use as well. One of the most common side effects of Viagra is a headache, which can affect up to 16% of men who take the medication. Other common side effects include flushing, indigestion, and nasal congestion. These side effects are usually mild and transient, resolving on their own without the need for medical intervention. However, suppose these side effects persist or become bothersome. In that case, it's recommended to consult with a healthcare provider to determine if any adjustments to the dosage or alternative treatment options may be necessary. In addition, it's crucial to note that there are rare but serious side effects associated with Viagra, including sudden vision loss, hearing loss, and priapism, a prolonged and painful erection. Therefore, medical attention should be sought immediately if any of these symptoms occur. It's important to discuss any potential risks associated with taking Viagra with a healthcare provider before starting treatment. There are also more serious side effects associated with Viagra. One such side effect is a sudden loss of hearing or vision, which is rare but can be a cause for concern. It's essential to report any vision or hearing loss symptoms immediately and seek medical attention as necessary. Furthermore, it's important to discuss any potential interactions with other medications before beginning treatment with Viagra. Specifically, Viagra can interact with certain drugs such as nitrates, commonly prescribed for treating chest pain or angina. When taken together, Viagra and nitrates can cause a significant drop in blood pressure, which can be life-threatening. Therefore, you must inform your healthcare provider of all of the medications you are currently taking, including prescription drugs, over-the-counter medicines, and herbal supplements. Your healthcare provider can assess your risk for your potential interactions and help you determine the most appropriate action. Another potential risk associated with Viagra is priapism, a rare but potentially serious side effect of Viagra use. Priapism is characterized by a prolonged and painful erection lasting more than 4 hours and can permanently damage the penis if left untreated. While priapism is low, it's important to be aware of the symptoms and seek medical attention immediately if you experience a prolonged erection after taking Viagra. If left untreated, priapism can cause blood clots in the penis, leading to further complications such as tissue damage, erectile dysfunction, and even permanent impotence. Therefore, it is crucial to seek medical attention immediately if you experience any signs of priapism, such as a prolonged and painful erection. Your healthcare provider can assess the situation and provide appropriate treatment to prevent further complications. So, who should avoid taking Viagra? While Viagra is generally safe for most men with erectile dysfunction, certain groups of people should avoid taking Viagra due to potential health risks. These include men taking nitrates or alpha blockers, medications commonly used to treat high blood pressure, and chest pain. Taking Viagra in combination with these medications can lead to a dangerous drop in blood pressure, which can cause fainting, dizziness, and other serious complications. In addition, men with severe liver or kidney disease may be at an increased risk for adverse reactions to Viagra, as the medication is primarily metabolized in the liver and excreted through the kidneys. Men with certain heart conditions, including unstable angina or severe heart failure, may also be advised to avoid taking Viagra due to the potential for cardiovascular complications. Furthermore, men with a recent stroke or heart attack may be at an increased risk for adverse reactions to Viagra, as the medication can affect blood flow and circulation. Finally, men allergic to Sildenafil, the active ingredient in Viagra, should avoid taking the medication and seek alternative treatments for their erectile dysfunction. In addition to the groups mentioned above of individuals who should avoid taking Viagra, there are several other factors that your healthcare provider may consider before prescribing Viagra for your erectile dysfunction. These include age. While Viagra is generally safe and effective for most men, older men may be at an increased risk for adverse reactions to the medication due to age-related changes in the body. Your healthcare provider may recommend a lower dose of Viagra if you're over 65. Smoking. Smoking can contribute to erectile dysfunction and may increase your cardiovascular risk. If you smoke, your healthcare provider may recommend quitting before beginning treatment with Viagra. Alcohol use. Drinking alcohol in excess can impair your ability to achieve and maintain an erection and may also increase your risk for certain side effects of Viagra. Your healthcare provider may recommend limiting your alcohol intake or avoiding alcohol altogether while taking Viagra. Certain medical conditions. Besides those mentioned above, men with certain medical conditions such as high blood pressure, diabetes, or prostate problems may need to be monitored closely while taking Viagra. Your healthcare provider can help determine if Viagra is safe and appropriate for you to use based on your health status and medical history. It's important to note that Viagra should only be taken as directed by your healthcare provider. The recommended starting dose of Viagra is 50 mg and it should be taken approximately 1 hour before sexual activity. The effects of Viagra can last for up to 4 hours and it should not be taken more than once per day. And if you found this video informative, please give it a big thumbs up and share it with others who might benefit from it. Also, don't forget to subscribe to our channel Beyond Health to stay updated with our latest health-related content. Thank you for watching.